Welcome to Ulosca channel. Access all nursing practice questions. Adult Health 1 CBU. Practice questions with answers.
Question 1. What is the normal range for adult blood pressure? A. 160 to 140/90 millimeters of mercury. B. 110/70 to 130/85 millimeters of mercury. C. 120/80 to 140/100 millimeters of mercury. D. 90/60 to 120/80 millimeters of mercury. Which one is the correct answer? The correct answer is D. 90/60 to 120/80 millimeters of mercury. Explanation. Normal adult blood pressure is generally considered to be 90/60 to 120/80 millimeters of mercury. Values outside this range may indicate hypertension or hypotension. Question 2. Which of the following is the most common cause of hypertension in adults? A. Chronic kidney disease. B. Hyperthyroidism. C. Obesity. D. Diabetes mellitus. Which one is the correct answer? The correct answer is C. Obesity. Explanation. Obesity is the most common cause of hypertension in adults as it contributes to increased blood pressure and overall cardiovascular strain. Question 3. What is the recommended first-line treatment for a patient diagnosed with type 2 diabetes? A. Insulin therapy. B. Oral hypoglycemic agents. C. Exercise and diet modifications. D. Surgery. Which one is the correct answer? The correct answer is B. Oral hypoglycemic agents. Explanation. Oral hypoglycemic agents, such as metformin, are typically the first-line treatment for type 2 diabetes, alongside lifestyle modifications. Question 4. A nurse is assessing a patient with a suspected myocardial infarction. Which of the following signs is the most characteristic of this condition? A. Shortness of breath. B. Chest pain radiating to the left arm. C. Nausea and vomiting. D. Diaphoresis. Which one is the correct answer? The correct answer is B. Chest pain radiating to the left arm. Explanation. Chest pain radiating to the left arm is a classic sign of myocardial infarction and should prompt immediate action. Question 5. A nurse is caring for a patient with congestive heart failure. What is the priority intervention? A. Administering diuretics. B. Monitoring vital signs. C. Administering vasodilators. D. Encouraging deep breathing exercises. Which one is the correct answer? The correct answer is A. Administering diuretics. Explanation. Diuretics are essential in managing congestive heart failure by helping to reduce fluid retention and decrease the workload on the heart. Question 6. What is the most common complication of uncontrolled diabetes mellitus? A. Renal failure. B. Hypertension. C. Diabetic ketoacidosis. D. Stroke. Which one is the correct answer? The correct answer is C. Diabetic ketoacidosis. Explanation. Diabetic ketoacidosis is a common, life-threatening complication of uncontrolled diabetes, especially in type 1 diabetes. Question 7. Which of the following is a common side effect of opioid analgesics? A. Diarrhea. B. Drowsiness. C. Hypertension. D. Tachycardia. Which one is the correct answer? The correct answer is B. Drowsiness. Explanation. Drowsiness is a common side effect of opioid analgesics due to their sedative properties. Question 8. A nurse is educating a patient with chronic obstructive pulmonary disease. Which of the following statements should the nurse include in the teaching? A. You should avoid all forms of exercise. B. Oxygen therapy should be used when needed to improve breathing. C. Excessive fluid intake is beneficial for controlling the symptoms. D. You should not receive vaccinations while on medication. Which one is the correct answer? The correct answer is B. Oxygen therapy should be used when needed to improve breathing. Explanation: oxygen therapy is crucial for COPD management. Exercise should be encouraged within limits to improve lung function. Question 9. A nurse is monitoring a patient on an antihypertensive medication. Which of the following side effects should the nurse be concerned about? A. Hypotension. B. Tachycardia. C. Weight loss. D. Hyperkalemia. Which one is the correct answer? The correct answer is A. Hypotension. Explanation: hypotension is a common side effect of antihypertensive medications and should be monitored to avoid complications such as dizziness or fainting. Question 10. What is the most important assessment for a nurse to make when caring for a patient with a deep vein thrombosis? A. Assessment of the pulse in the affected leg. B. Monitoring for signs of respiratory distress. C. Inspection of the affected leg for redness and swelling. D. Measuring blood pressure. Which one is the correct answer? The correct answer is C. Inspection of the affected leg for redness and swelling. Explanation: redness, swelling, and warmth in the affected leg are common signs of DVT and should be carefully assessed to prevent complications like embolism.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.